Mr. and Mrs. Swinehart, thank you very much for coming here this afternoon. Please describe to me what brought you into the hospital a couple of months ago.
Well, I woke up one morning and had a very swelled up leg, and it was a surprise to me. And I looked down at my foot, and my foot was sort of blue. And I called my doctor and said, hey, I'd like to come into your office this morning and have a look at my swelled up leg. And he asked me to describe it and told me not to come into the office, to go right to the emergency room.
What treatment options were you given upon your admission to the hospital?
The standard treatment was to inject a blood thinner via needle and then to take Coumadin.
And the traditional treatment for the blood clot would have really made him be very, very limited in his activities.
I understand your wife has a medical background, and she was able to find some information about the procedure that you were able to undergo successfully. Could you tell us about that particular episode?
I came home that night and just by chance opened the Naples Daily News, and there was an article in there about the procedure, the Trellis procedure. I had never heard of it before, and I hurried up and called him back at the hospital and suggested that he get a consultation from a vascular surgeon, and so that's how he wound up meeting you.
The procedure was performed the next day after I saw you, and I believe it took approximately 40 minutes. Can you describe your experience?
The swelling in the leg went down immediately. After the surgery the next day, my leg looked natural.
You were then able to be discharged home the following day after the procedure.
The next day I was discharged, yes.
What kind of lifestyle or recovery were you able to resume following the Trellis procedure?
I played golf a week later and didn't have any problems at all.
That's an excellent outcome that we always hope to achieve.
And my handicap's two strokes lower.